Hello and welcome back to Nursing Concepts by Tisha. So today this video is going to be really different where I'm going to be in conversation with one of my teacher. He holds a very good amount of experience of working as a nurse in India and right now is working as a critical care nurse in UK. Well, in this conversation, we are going to talk about the nursing in India and nursing in UK. In this video, we are also going to discuss about the different competitive exams like OET, like IELTS, like HAAD, which is known as HAAD, the Prometric exam, the exams which are required for the fresher staff nurses or maybe the experienced staff nurses to work in different countries apart from India. So let's get started and don't forget to watch till the end to get an insight about the nursing in abroad. So hello and welcome back to Nursing Concepts by Tisha. So finally the hour has come when I am in conversation with one of my greatest mentor, that is Mr. Sam David. So for my learners and my viewers, I would like to give an introduction and I feel immense pleasure in introducing Mr. Sam. He is basically my mentor from whom I learned a lot and he holds more than 15 years of experience. Currently, sir is working in England, I guess, sir. Am I correct? Are you working in England, Birmingham? Yeah. And sir is working as a critical care nurse. Thank you so much, sir, for accepting my invitation and coming in call with me to discuss some of the aspects of nursing in India as well as in abroad, about the various scope of nursing in abroad and various other things. So thank you so much.
Thank you so much, Itisha, for having me. It's an absolute pleasure for me.
It's my pleasure, so much. Sir. Okay, sir. So let's get started directly onto the main topics that we actually had thought, because I and various other students are very much eager to know how it is working in abroad. Means since we are in India, the nursing in India is, I guess, completely different to nurses' life in abroad, right? Be it in personal life, be it in professional environment or social environment, it's completely different. So can you please share your views about how do you feel working there, or what are the benefits like you are getting there, or means anything regarding this maybe?
So answering your question in short, working in abroad depends with people's perception. Could be gender difference, could be people, their background, their cultural background and everything. Because being a male, and I migrated to a English-speaking country at the age of 35. So I wouldn't say it's not a young adulthood. So it's a married life for me. So my aim to move on to abroad is to expand opportunities to my kids rather than earning lots of money. So money is not my thinking. When I moved to UK, that is England. So I was family oriented. Whatever I think, it was just what the family wants. So working in abroad, that's why I say difference with the gender and difference with the marital status you are. Whether you're married, you're a spinster, you're a bachelor, that makes a big difference. So for youngsters, I would say, go to somewhere Middle East, work, get some money, earn some money, send back home. Because that's actually, Indians are like work oriented. We want to earn lots of money rather than, because if you move to the West, more than earning, they want to live. What they earn, they live with the money. So they don't have a habit of saving it to get a property or something. So they're not into it. So it depends upon what's your culture background, one thing, and what is your gender and what is your marital status at that time. So I would suggest for any Indian nurses, go for a bachelor and a spinster who are not married, go to a Middle East country, earn some money, at least for 3 years, good, decent 3 years, earn a lot of money, send back home. So you get a confidence. Because why I say Middle East is Middle East where the standards guidelines, they follow the West.
That's
so it'll be easy.
Now.
Yeah, so it'll be very easy for you if you work in Middle East and then bounce to another Western country, either England or Australia or America. So it'll be very easy for you.
So is it just the money?
If you are a family, then Middle East won't be a good option.
Okay.
because Middle East is not for living. So you earn money, send back home. That's it. Because you can't have a visa. You have to renew your visa every 2 years. You can't get a citizenship there, and you can't get a property unless you are a billionaire. So it's a good place to earn money. It's a tax-free country. So you earn money and send back home, and you buy a property or you invest in some business or whatever you do. So you have a fruitful
Future ahead, I guess.
youth life, and then you if you are a person who wants to save a lot of money, save it in the Middle East. Then if you are married, then move to the Middle East. Sorry, move to the Western country.
I guess this is going to be very much encouraging for the aspiring nurses who are wanting to go abroad and they are wanting to earn money and then settle there also. So, like you said that you had gone, like you had moved abroad when you were 36 or 35 or 36 years of age. Am I correct?
Mm-hmm. So to the West, but I moved to Middle East when I was, I think it was 33 years. I moved to Middle East, worked there for 5 years, and from there I moved to the West country. To be a bedside nurse, why I wanted to be a bedside nurse is like the guidelines back home, the guidelines, the policies, it's not updated in the college side. It is always updated only when you are working in hospitals. So if you want to be updated with the policies and the guidelines, you have to be in the bedside. You have to be in the clinical area. That would be my advice.
So, like you mentioned that initially you had gone to Eastern countries, then you went to the West, and right now you are working in a different environment, different setup, different area completely. So, do the aspiring nurses who are right now maybe students or maybe the working nurses who are wanting to go to abroad, do they need to qualify some specific exams or some specific requirements are there to go and work over there, or like anyone can approach and anyone can fight for the exams, anyone can just book the tickets, just get the visa, and we are there, something like that, or what is it?
No, it's quite a process actually. There's a lot of waiting time to it. You have to be patient. I have to have lots of patience on that. To move abroad, it's your aim where you want to go. So your examinations depends on where do you want to go, because Middle East have separate set of examinations, and the Western countries they have a separate board examinations. If you want to go to Middle East, then it's a Prometric examinations. So the Prometric, the way of examinations is quite similar, but the licensure exam is different. For instance, if you ask me, United Arab Emirates, which has 7 emirates in it. So the popular emirate is Dubai, Abu Dhabi, and Sharjah. So if you want to work in these 3 emirates, they have different licensure. So if you have a license in Abu Dhabi, you can't work in Dubai. If you have a license of Dubai, you can't work in Abu Dhabi. The hospitals in Abu Dhabi, they have a HAAD. That's the license name, HAAD. And in Dubai, it's DHA. And for us, for other emirates, that's a separate licensure. So each emirates has a different licensure. So one Prometric exam doesn't fit to the other, but the way of the questions, the way of examinations is all similar. The preparation is going to be similar, but the licensure is different. That's what I mean.
So when you're talking about these exams, like you have mentioned HAAD, that is hard. Do we pronounce it as hard? Yeah. Okay. Then other exam, you said DHA exam, right?
Yeah, exactly.
Yeah.
And the other emirates is MOH.
MOH, yes. Okay, MOH.
Yeah, Ministry of Health. Yeah.
So, as per my very minute, tiny knowledge, I had only heard the names of 2 exams, I guess, OET and IELTS exam, which is particularly for the English, I guess, and the Prometric I heard from various my friends who are already working abroad. So, can you please throw some light on what is OET, what's IELTS, what is Prometric, what is the difference between these 3, and which exam is for which country also?
Okay. To answer that question, you have to be very clear. So, what step you're starting with? So, there are 2 steps to go through any exam in Middle East. One is you have to show your qualifications, how many hours you worked, in which area you worked. You have a third party which do all those credit checks on you. So whether your certificate is go
One
ahead.
second, sorry to interrupt here. Like you said, qualifications, right? You have to show your hours of work and all, something like that. So what qualification? Only bachelor's is required, or master's is required, or some specific diploma course is also required along with it?
No. I think even in India, the Indian Nursing Council (INC) they put a milestone where if you want to work in abroad, if you're applying abroad, you have to be at least bachelor's of nursing.
Yes.
So general nursing midwives, that's not accepted anymore. That's not accepted in Middle East or either in any Western countries. Okay. So it doesn't mean that who has completed GNM and working in a hospital has to be should not think about going abroad. So they have another things that from if you qualify GNM, then you can do a post basic, which is equivalent to which is equivalent to bachelorate of nursing. So any Western countries, any Middle East countries, either Singapore, Malaysia, they're demanding if you want to work as a registered nurse in their country, you have to be a bachelorate nurse. If you go with the GNM certificate, certain agents they do accept it, but when you come back here, you can't work as a you can't work as a nurse. So you have to be working as a healthcare assistant.
Okay.
So you can't give medications. You can't be a complete nursing professional. Just the basic, like giving bath to a patient, feeding the patient, taking them for a walk, like a carer kind of profession.
Only basic
so that's
stuff.
a healthcare assistant. Yeah.
So coming back to our main section.
Bachelorate of nursing is the minimum qualification. To answer that question,
no other exam is required. Means exam in the sense, no particular specialization in ICU, in CCU, in particular department. Nothing of that sort is required.
No. In India, we don't have that in our curriculum. We don't have that.
We don't have. Yes.
In the bachelorate nursing, we have everything covered, and that is accepted in any countries. Bachelorate degree is accepted here. So, so to answer your previous question, so the Prometric, that is completely professional, nothing to do with any English language testing.
Okay, completely nursing based.
Exactly. So it's only nursing based, but the questions they ask is different from Prometric, and it's difference in CBT, which is an examination for UK.
Computer based. Okay.
And NCLEX, which is another professional exam in America, Canada, and Australia. So the professional exam, nursing professional exam, are divided into three. One is Prometric to Middle East, and CBT to UK, and NCLEX RN, which is for America, Canada, and Australia.
So which one is tougher?
This is the professional. I would say NCLEX is tougher. It would be easier for Indian nurses because the curriculum structured by INC is American curriculum. So it'll be a little easy for us. If I want to say example in the NCLEX exam, they'll ask about planning. The questions will be related on planning, will be related on diagnosis. In CBT, they don't have nursing diagnosis at all. Nothing called nursing diagnosis. They just have only planning and implementation, no nursing diagnosis.
Oh, no diagnosis. Okay.
No. So NCLEX and NCLEX it has planning questions, diagnosis questions, implementation questions, and evaluation questions. So these are the four categories they ask the questions. So if you go to CBT, every question will be scenario based. So, for example, if a patient is having 101 degree Fahrenheit of temperature, so they'll ask the reasoning. So what would you do? So they gave a scenario and they want you to answer that.
That means
it'll be multiple choice questions.
Okay,
but still the questions will be like a scenario based. They give a scenario and you have to answer. You have to put yourself on that position and answer the question as a nurse. But in NCLEX and RN, the questions will be completely different on planning. It'll be different on diagnosis. So what they give a scenario, and they'll tell you what diagnosis fit to that. So you have to give a clear diagnosis on that.
That means a completely MCQ based kind of setup is there. The structure, the format is an MCQ thing.
Yeah, so every format of questions, either Prometric, either CBT, either NCLEX, it's all multiple choice question.
Okay.
But the weight, the way of questions they ask is different. So Prometric copy the CBT, like the exams to the UK. So
Prometric is for UK.
Copies, yeah. So they copy. I mean, the Prometric the format of exam is equivalent to. They copy it from the CBT exam. Okay. So if you have training for the Prometric exam, to clear CBT is easy. But to prepare for an NCLEX exam, it will be a different kind of preparation. That's what I mean.
And you know what, sir, in India, I think so my Indian nurses will be very much aware of this term NCLEX. Because why? Because usually when in India, when this AIMS hospital, you have heard of AIMS, right? When this AIMS conduct its own exam for the staff nurses recruitment, they are giving mostly questions from this NCLEX. So every of the nurse in India, graduate nurses or maybe experienced, who are preparing for this AIMS especially, they are referring this NCLEX and they're preparing from that only. So whichsoever student or my colleague,
the good thing is before that we have to go to America, get a visa, get a NCLEX exam visa to appear for the exam. Now you can do it in India itself.
Yeah.
So no need to go there. That's a good. That's one of the good things.
Okay, so how much what is the process, sir? Like once I have clarified my my BSc, my bachelor is completed, then do I need some experience to fight this exam?
Yeah. No, experience would be very much appreciable. You have to take at least 1 year of examination to get out of the bedside fear. Take at least 1 year of experience.
Okay.
Recent years, when there was much demand during the pandemic, the UK government didn't ask for any experience, so the freshers they were recruited straight away.
Okay.
But that won't be the case every time, because since they had a demand during pandemic, they just recruited. But that won't be the case every time. So I would advise take 1 year of time, practice in the bedside, be on the clinical side, be patient, prepare for your examinations. Then you can apply that.
So that means any student who is...
As I said, two steps. One is professional exam. Next one is the language proficiency exam. Okay. So OET, IELTS, all these are language proficiency exam. So the difference between IELTS and OET is IELTS is very low in cost. IELTS is a common English proficiency exam. But OET is occupational English testing. So my occupation is a nurse. So they have 4 modules. One is reading, writing, listening, and speaking. Even IELTS has the same module: reading, writing, speaking, and listening. So they test on these 4 skills. So these are the modules. So for example, reading, in IELTS, they give a passage. You have to read and answer the questions.
Okay.
And for speaking, they give a topic and you have to speak.
Okay.
And for listening, they'll play an audio. So you have to listen, and the questions will be from that audio.
Okay.
It could be either 2 persons a dialogue, or it could be 2 conversations, 2 persons conversation, or it could be a monologue, 1 person giving a lecture or talking about something, or it could be a podcast, or it could be a radio speech or lecture, and the question will be asked from that audio. So in OET, the audio, the topic, whatever they give, the passage to read, whatever they give, it's all related to nursing.
Okay, that's the basic difference.
And everything is all related. It's all related to nursing.
Okay.
But in IELTS, it's a general English testing proficiency. for example, they'll ask for you to talk about. Okay, for example, in a speaking module, they'll ask speak about your recent holiday trip. So it's a general topic, isn't it?
General topic, correct.
And for OET, they don't ask that. So for OET, it'll be a conversation. There'll be a role model to play, and they'll play as a patient, and they'll be coming to your clinic, and they'll be saying that their signs and symptoms. They say I have a pain in my hand and everything. So as a nurse, you have to diagnose, and what you will talk to the patient and a nurse, patient and a nurse,
Okay.
or a nurse and a doctor, something like that. So it's completely within the profession.
Within the profession. Okay. So is it like these countries are preferring OET exam, these countries prefer IELTS exam? Is it like that, or a student has to give both the exams?
So OET is preferred only by Australia and UK at the moment.
Okay. Is preferred. That means you said it is preferred. That means IELTS also they can go for IELTS.
Yeah, they apply. Yeah, they go with the IELTS as well.
Okay.
But sometimes they change criteria. But the scoring would be different. For IELTS, they have to score more, and for OET they have some band scale. They reduce sometimes.
Okay.
They adjust to get more inputs into the country.
And so, what band scale is considered good? Like you mentioned, no band scale. Like I have heard band scale of 7, of 6, something.
Yes. No. That is for IELTS. But for OET, the band is A, B, and C.
Okay.
So one can have 1A, B, and 1C, 2C, I guess. And not if anyone is having a D in one of the modules, then they're disqualified. So they have to appear again.
Okay, so OET is ABC kind of thing, and IELTS is like 1, 2, 3, that kind of format.
For instance, you know your level before going for any training. So if you're not confident enough, because if you go to IELTS, you have to from the basic. If you don't have enough knowledge, if you think enough knowledge about English, you have to start from the build up from the basic, like study some grammar, to study how to frame a sentence, and all the structures you have to learn. So there's a different way how to develop the skills. Nowadays you've got some YouTube lectures, classes.
Yes.
And for OET you have many WhatsApp groups, some groups in the Facebook where they share the materials. So you get it online. It's easy to access actually.
So that means any candidate, any nurse who wants to go to abroad to work there as a nurse, he or she first needs to qualify their bachelorate in nursing. Am I correct?
Yeah.
Then after that they need to increase their language proficiency, particularly English, because they are going to go into English speaking countries. Am I going right, sir?
Yeah.
Once they have worked on that, then they'll have to fight different exams, be it like you said HAAD exam, then Prometric exam, or the other
Prometric,
exam.
Yeah.
Prometric.
So you call it Prometric of Qatar, Prometric of Dubai, Prometric of Abu Dhabi. So everything is called Prometric exam. Yeah.
Okay, everything. Okay, then they'll go for Prometric exam. Once they have clarified their exam, they got the required marks and required bands and everything, then they will get a call letter from that particular hospital, or they are applying to the country.
No.
How is it?
No. Just the examination just gives you permission that you'll pass the exam, and they give you the license.
Okay.
To work in a hospital, you have to go through an interview.
And what if we are rejected?
You have to try for another hospital.
Okay.
Exactly like what we have it in India. So we have a license. We get a license from a university. We get a license from the state council, state nursing council. It doesn't mean that we get a job.
Yes.
So to work in a hospital, we have to go and apply.
Correct.
Same. Yeah.
So majority of my friends and like you also who are working out of India and abroad in any of the country, everyone mostly goes for the bedside nursing, for hospital nursing, right? For clinical sectors.
Yeah.
My question always is like, why no one is going there and entering the teaching profession? Why no one is teaching over there, like in India? So why is it that in abroad, clinical nursing is preferred by the candidates than the teaching?
In my opinion, interviews conducted for the clinical or the bedside nurse is straightforward.
Okay.
To work in a university or to work in a they don't call it here as a college. They call it as university in England. To work there, they've already got nurses who are working in the bedside.
Okay.
So right now, to be a sponsor, only clinical nurses are allowed.
Achha.
Because the university is not recruiting any nurses or any lecturers straight from abroad. So the universities are not recruiting for any lecturers straight.
Okay.
So the nurses are the nursing recruitment to the bedside is more straightforward than the university recruitment.
So, sir, getting back to where we were actually talking about like nurses mostly opting for clinical nursing over there and instead of teaching and what the country allows particularly. So, next thing I would like to know, and I think so most of the students would be wanting to know if any student who is wanting to go abroad and has done MSc nursing, will he or she get some extra benefits or some extra maybe salary or any extra kind of thing, or like BSc and MSc are same once we move out of India?
Yeah, I would say if you have a plan to go abroad, then don't do MSc. That would be my suggestion. Otherwise, you're wasting 2 years of your time. Because Western countries, they're not valuing masters in nursing anymore. If at all, but they value the experience. But MSc they don't value masters in nursing. But here they have 1 year of super specialty. So in my case, I'm a critical care nurse, and I have 6 months of a course, which is a super specialty, which is advanced critical care nursing.
Okay.
So if the NHS funds for a nurse to study that, and once they've studied, their they'll be promoted to a band 6. I'll be promoted to a band 6 if I complete that 6 months course.
Okay, understood.
Yeah, though I've been qualified in India as a advanced critical care nurse, they still they don't value it. They still want to do it from here. So band 5, band 6, band 7, the salary also increased with that. So another growth is horizontal, which is I'm a band 5, I'm a registered nurse. So I can upgrade my if my NHS is funding me to study, I can, from being a nurse, being a critical care nurse, the next step I can go to an advanced critical care nurse. So that's a 1 year course. And from there, I can apply for a clinical practitioner. So where you are allowed to prescribe certain medications, you're allowed to prescribe certain investigations for the patient. So these clinical practitioners, they work, they duplicate the work of the doctors. The doctors, not the specialist, the general medicine doctors. Okay. That's what who has completed MBBS. Yeah. Okay. So the clinical practitioner role here, they duplicate, they do the task of what they want. A doctor will be doing in an emergency, a doctor will be doing in a critical care. So they as being a nurse, they go for a clinical practitioner course, and they get trained and they work as a clinical practitioner. Okay. That's what actually I was wanting to know. What about the scope of nursing apart from clinical? So, like you mentioned, clinical practitioner. Okay, so that is something like nurses will be in critical care. They call this advanced critical practitioner. Okay. And in emergency, they call advanced emergency practitioner. Advanced emergency practitioner. Yeah. So the horizontal development is within the area. So if you get recruited to a critical care, so you'll be expanding your role. You'll be working with the different professionals. You work as a doctor. You don't go to a MBBS kind of role, but still you work to that critical care. So advanced critical care practitioner, they call ACCP. Okay. So they work. They can work only with the critical care. They can't go to an emergency unit and prescribe medication, something like that. A clinical practitioner who is a prescriber, they can prescribe certain common medications like paracetamol, some multivitamins, certain antibiotics, not the broad spectrum antibiotics, certain mild antibiotics they can give.
Like in India right now, there's a program running which is known as CHO program, that is Community Health Officer. So they are also, government is training these bachelor in nursing, BSc nursing graduates and MSc nursing graduates to work in certain areas, specifically the rural areas where the healthcare accessibility is less. So the nurses are getting trained to conduct basic nursing procedures, also basic medical procedures, and CHOs are allowed to prescribe certain medications, not the broad spectrum and high spectrum, but yes, similar kind of thing.
So they have a physician assistant course as well. So like BSc nursing, they got bachelor in physician assistant course. So they, in the first year, they straight away go to the specialty. So they'll be trained only about cardiology, cardiovascular, cardiothoracic, and they work under a cardiothoracic surgeon. So a patient who had an open heart surgery, CABG, they'll be followed by these kind of physician assistants. So in India, even in South India, there's certain hospitals, they don't want to recruit a bachelorate nursing. So they have auxiliary nursing midwife, A&M they call. They recruit GNM, so they can pay 5,000, 6,000, and they work. They know even that nurses are satisfied and they agree to it and they work.
Yes.
And so here in India, it is here in UK it is different because it is all funded. It's all public funded. So imagine there is no private hospital at all in India. So that is the case here. They do have a private hospital. They do have a different kind of private hospital, but that's not funded from NHS. So more treatment, more guidelines, more policies that's been developed only from the NHS side. So the nurse, the nurse is valued, that the work they do is valued here, and still they fight for the high pay here. No one is going to no one is going to be satisfied with the
that is true.
with the salary, with the money. When
no
it
matter
comes
how
to
much
money,
you get.
There's no when it comes to money, there's no satisfaction at all. But still, the Indian nurse has to be paid decent amount because they do a lot of work. And the shift work back home, I'm not sure whether it's still 3 shift.
In some hospital, it's still 3.
Day
while
shift,
the others,
evening shift, and a night shift.
Yes.
So it is 8 hours duty back home.
Yes. But
so here it is 12 hours, but it will take 10 hours and 12 hours. They do an extra, which is not paid for them.
Okay, which is not paid.
In India. No, in India, I'm saying.
In India, yes.
Though they say 8 hours, after giving handover, it will be 10 hours, 11 hours duty.
Yes, it happens.
But for that extra hours, they are not paid.
They are not paid, correct.
But here, the shift is 12 hours. 12 hours in the day and 12 hours in the night. The day shift is divided to 2. Early shift and late shift. So the minimum hours you have to do is 37.5 hours in a week.
Okay.
Yeah, so that is the basic. That's the full-time job. If you are working anywhere below 37.5 hours, it's considered as a part-time job. It's not a full-time job. And for instance, I can give a figure like in a week I go 3 days.
Okay.
So 12-hour shift, 12-hour shift, 12-hour shift. And in 1 week, there's 4 weeks in a month. So in one of the week, I have to work 4 shifts, 4 12-hour shift.
Okay.
To make up 37.5 hours in a month.
What is it about the respect of nurses over there? Like in India, nurses are respected less. Yes, definitely post-pandemic, nurses have come to the forefront. Everyone is talking about nursing. Everyone is trying to give nurses the due credit which they should be getting. But usually, this, I shouldn't say, but yes, doctors get all the due credit, but the nurses don't get in India. So is it the same over there also, or the nurses are getting the credit, or nurses are not being credited? Something means, what is your take on this?
No. Here, it's completely different. Back in India, The nurses, they're not involved into policy making. They're not involved into guideline making. Some nurses who have completed masters in their nursing, PhD in their nursing, and the nurses who have completed PhD and they who are involved in the nursing council post, who are the members of the INC, they get involved to the policy. They are the policy makers.
Yes.
And mostly the upper hand is only by the doctors.
Yes.
To make a policy for example, a tracheostomy patient, to make that policy or a guideline, only doctors are involved. Very few amount here and there, nurses are involved. Say, for example, midwifery, the pathway of labor, to have a different. The doctors are more on the as a policy makers, not the nurses.
Yes.
But here, the main difference from India and UK or any West countries is here they follow the evidence based practice.
Practices, correct.
Yeah, the evidence based. What I say is they do a research. If there is infection, they want to give an infection protocol or to minimize an infection. They frame a guideline. They make a policy. They make it as a policy, and they follow it everywhere. So those research groups, even nurses are involved into them.
Oh, nice.
But back home, that's not valued.
Yes.
So the nurses are not involved much into policy making and guideline making.
Yes.
So that the doctors are having upper hand. Here, even the education is more like critical thinking, research, evidence based, only on that. If there is an evidence, they practice it, and the evidence comes from the research.
So, like with this, I can say like nurses over there are almost equivalent to doctors in terms of respect, in terms of like
Definitely,
getting included
I can question
in
a doctor. For example,
yes.
If I'm for 7 o'clock, I'm going to the duty, and they assigned one of my patient, and I am the nurse for that patient. And if the doctor is coming to my bedside, the doctor will ask me, "Can I assess your patient?"
Oh.
And the doctor asks me permission, and then if I'm disagreeing to him, saying that the patient is in pain, say if the patient is in pain, and he told me, and I have to be an advocate for the patient. So the doctor can't go without asking me.
So, would you like to give some advice or some piece of advice from your side for the aspiring nurses through this platform?
Yeah, to wind up, it was a good conversation. And as listeners, to all the listeners of this video, I would say, as Itisha know, I'm not a native speaker of Hindi, so I don't know Hindi. So if I want to learn, most of the words, most of the sentence, the way of expression in Hindi from where I worked in Gwalior, everything I learned from the students. So if I want to learn Hindi, the first thing is I need to give a preparation. So if you're going for an exam, English proficiency exam, just bear in mind that English is just a language, just another language. It's not it's not something where you have to acquire knowledge. So it is just a language. So if I want to learn Hindi, I would talk to a native speaker, a person who is speaking Hindi. I would watch more Hindi movies. So these are the small things you have to catch up and do. So you should be having your medium of studies should have been English in your schools, at least to pass out professional English testing. So if your medium is English in your schools, then it'll be very easy for you to clear the exam. Just by little preparations. Watch some movies, watch more English podcasts, turn on to English radios, and read newspapers, read more novels, more books. So these all the things, by the time you develop the nursing, just as I said, it's just a language. So you need some time to have a practice on it. So
Correct.
my goal would be, if you want to go abroad, don't do post graduation. Just concentrate on your bedside experience. Do your proficiency English proficiency exam. Prepare for your professional exams like Prometric, CBT, and NCLEX,
Yes.
and gather some experience on the bedside. And try to imitate. Go in front of the mirror. Try to talk in English. Try to imitate how people talk, how the English people talk, how the American people talk. So I try to imitate. So these are the ways you develop your skills. It's not so hard. It needs patience. That's it. So for
And
every of the listeners, I would say all the best for your future.
thank you so much, sir. It was really nice having you here, and you sparing your precious time. And since we are in a different time zones right now, so it is really grateful of you to spare
Absolute
some
pleasure.
time. And
I know Atisha is making some effort for the listeners.
yes, I'm
So
trying.
yeah. So happy for you, what you're
Thank you
doing.
so much. Thank you so much.
I'm so happy of what you're doing now.
Thank you so much, sir. So thank you so
Thank
much.
you, Tisha.
Thank you, sir. And thank you to all my viewers for listening to this video. I hope you like the content. And if you come across some other questions and you want me to come up with some other personal also to answer your various questions, please drop your questions into the comment box. That's it. Do like, do subscribe to my channel. Thank you.